In this video, a very simple way of understanding acute abdominal pain based on anatomy and pain physiology will be presented without any diagnostic aids. So let's get into it. I will describe 4 basic types of pain with 2 big key concepts to understand, and finally we will tie all of this in according to the origin, location and pathology of the pain. First one is the visceral pain. So here's a cartoon of the abdomen and you can see the different organs. Now each of these organs, the colon, the stomach and the liver, on the surface have pain receptor fibers, with pain fibers taking the signals back towards the brain. And when these fibers are excited, the pain is ill-localized, more general, achy type, and often associated with nausea and vomiting. The parietal pain originates from the lining of the abdomen. So this is the front of the belly and this is a side view, and I've shown the lining called the peritoneum. This is very richly supplied by pain fibers, and any excitation of the lining causes severe, well-localized pain, stopping the patient dead in their tracks, and any movement makes the pain significantly worse. So here is the front of the belly and here is the back of the abdomen, and the lining and the red is the lining. Referred pain is the pain felt remote from where the source of the pain might be, and this is dependent upon where the organ first developed and the pain pathways. At the back of the abdomen, this lining only covers the front of certain organs and blood vessels, and this area is called retroperitoneum, such as the pancreas and the aorta, the kidneys. They are all at the back, and typically they will cause pain towards radiating through to the back. And now to differentiate 2 key concepts to understand before making a diagnosis on pain. The first one is colic. Colic refers to pain originating from a hollow viscus or a tube, such as the GI tract, the biliary system and the ureters. The way a tube works is by propulsive movements shown in blue over here, causing the fluid or contents to move forward by rhythmic contractions. And the pain originating from these areas is fairly typical. It is rhythmic, comes on in waves and has periods where it relents before coming back on, timed with the contractions of these tubes. It makes the patient want to walk around and they cannot get comfortable. Now let's look at where this sort of pain can originate from. So this is the GI tract, the gullet, stomach, small bowel and large bowel. Any pain originating in this area will be colicky in character. The second tubular structure is the bile duct, the gallbladder and the bile tube, and typically the pain from the gallbladder is on the right side and radiates through to the back, and within the bile tube, if there is a stone, then it is in the upper abdomen all the way around like a band. And finally, the other tubular structure are the ureters around the kidneys, and this pain is the most severe colicky type of pain that radiates from the loin down towards the groin. So looking at this cartoon now, the severe constant pain implies irritation of the lining of the abdomen as shown over here. It's important to differentiate at the outset whether it is localized to one part of the abdomen or whether it is more generalized, in which case irritant fluid might be causing inflammation of the lining called peritonitis, or an intra-abdominal catastrophe such as the bowel losing its blood supply or pancreas being inflamed. Now it is possible for the patient to start as a colic and then turn into the more severe variety. In this cartoon you can see the stomach and the duodenum, early part of small bowel, in pink. This is part of the gut called the foregut, including the pancreas, the bile tubes and the gallbladder. This pain is developmentally always in the upper abdomen. The midgut is made up of most of the small bowel, marked out in light blue, as well as the greater part of the colon, and this is the midgut. And finally, the last portion of the bowel in brown is hindgut, and pain over here is going to be lower in the abdomen. So let's look at causes of colicky pain. Biliary colic, intestinal obstruction, either in the small bowel or the large bowel for whatever reason, will give rise to colicky abdominal pain. Constipation, as shown over here, with large quantity of stool in the colon. And finally, kidney stone. All of these will give rise to colicky pain. Parietal pain will cause significant local or generalized pain depending on the cause, and causing and moving, laughing. Patients tend to lie very still and tend to guard the area that is most at pain. Some examples are appendicitis over here, cholecystitis, the gallbladder with stones. When that gets inflamed, you get pain in the right upper quadrant. Diverticulitis in the colon, the commonest is on the left side. and pancreatitis over here, all of these infective inflammatory conditions will cause significant pain. What if the process is generalized? A deadly condition called peritonitis will cause severe generalized pain, as well as loss of blood supply to the intestine called intestinal ischemia. A word about intra-abdominal bleeding. This will cause pain initially where the bleeding starts, but it can spread to the rest of the abdomen. Blood is an irritant, as well as other signs of bleeding such as a high pulse rate, pallor, lightheadedness, fainting, loss of consciousness. So here are some examples of retroperitoneal pain, that is along the back wall of the abdomen. This is the pancreas, kidney, and dilatation of the main blood vessel in the abdomen called the aorta, called aneurysm of the aorta. All of these may well cause a significant part of the pain as back pain, and this is something to be aware of. There will of course be other symptoms of that condition. What about referred pain? When the pain actually occurs at a distant site from the problem. Appendicitis typically starts in the middle of the belly and then radiates down to the right side. Trauma to the spleen causes irritation of the diaphragm, and the pain radiates to the shoulder on that side. Equally, gallstone pain or gallbladder pain can also radiate sometimes to the shoulder or the back. Now let's review the pain in a schematic diagram of the abdomen divided into 9. So the foregut pain is high up over here. This is the midgut and the hindgut lower down. Pancreatitis in the middle. Early appendicitis over here and then moving down to the right side. Pelvic pain lower down in the abdomen on the sides, and kidney stones. Inflammatory bowel conditions cause a combination of colicky pain and parietal pain, and the location is dependent upon which part of the bowel is affected. This culminates a brief overview of pain, which is for information purposes only. I hope you found this useful. If you have any comments, please do share.